I'm Matt Willis, Public Health Officer for Marin County with a COVID-19 update for August 30th. On Friday, the CDC released a report about an outbreak of the Delta variant at a Marin County elementary school. The report gained significant national attention, and as one of its authors, I'd like to summarize why we thought it was important to share this now. The report is available on our website, but briefly, we've described an outbreak in an elementary school that happened at the end of the school year, just before the summer break. 12 of 24 kids in one classroom were infected, and an unvaccinated adult was found to be the index case. And this person had not been reliably masked 100% of the time indoors during their infectious period. It's a simple story, but has important lessons for us in Marin and for the nation as we reopen schools. This is the seating chart that we published, showing that proximity to the front of the classroom where the infected person was located increased risk of being infected. All children in the front row were infected. Risk was lower in the back of the room, but students in every row were infected. Eventually, we traced 27 total cases to this outbreak, including in siblings and parents of infected students. Here is the chart from the report that shows the number of cases each day over time. On the far left is a so-called index or first case. To understand why we chose to describe this outbreak in such detail, we have to go back to May. When this outbreak happened, all Marin schools were fully open to full-time in-person learning. Over 30,000 students were coming daily into 116 schools, public and private, across the county. Schools and public health were working closely together to detect and limit outbreaks, and we had systems in place to see and react to what was happening daily. Up to that point, we had only 12 total cases of in-school transmission countywide, distributed across several schools going back to August 2020. So when we saw a single school event with 12 more cases, double our previous total, we knew something had changed. When we sequenced the samples in the laboratory, we found that all in this outbreak were the Delta variant. At that time, Delta was still emerging, and we were still learning how it behaved. We thought that this was an important story to tell. Because of our strong collaboration with schools and with laboratories, we were in a good position to understand and share what we learned about indoor transmission of the Delta variant to inform emerging school policies, not only for Marin, but nationally. Here's the infographic the CDC developed to summarize the take-homes. First, the Delta variant is highly contagious and spreads easily indoors. That's really no longer news, but it has critical everyday implications. With Delta, there is a much smaller margin for error, especially in indoor settings, and where none under age 12 can be vaccinated. The next take-homes reinforce the basics around vaccines and masks. Unvaccinated people are at higher risk for being infected and infecting others. The implications of this choice are commonly misunderstood as being purely personal, but the virus uses unvaccinated people as a vehicle to spread disease. This report adds a tangible example of how this plays out in the classroom. We also know masks work to limit infection, especially when everyone is wearing them indoors. If our goal is to keep kids in school, everyone needs to stay masked, as is now the state law in California. Importantly, it's a mistake here to focus on individual blame. In fact, the message of this outbreak is the opposite. We need to build systems and policies that protect schools. This report is important precisely because it cuts to such common mistakes or misunderstandings, not rare or random ones. Remember, in many parts of the country, schools are fighting for the right to require face coverings indoors, and less than half of those eligible are vaccinated. This report adds to the national evidence base that will support stronger new policies in those places that need it most. This is very well timed and explains why this report is among the CDC's most often cited reports already. I'm proud of the Marin County team, which includes the school community that was impacted by this outbreak, for delivering science, into one of the most politicized areas of this pandemic: masks, vaccinations, and schools. With our children's well-being and the safety of our school communities on the line, there's nothing more important to get right. Thank you for doing your part.